Well, let me say that you're using an analogy which I don't think is a very valid one. You're using the analogy of what would happen if the government were to offer free entertainment. Okay, free entertainment is far different than free health care. Okay, now I'm not convinced that we should make health care absolutely free. Of course, it can't be absolutely free. It's got to be paid for somehow. But the analogy doesn't hold. A person will not go for 5 open heart surgeries simply because it's free. All right, a person will tend to want to minimize any sort of medical intervention that they can. They don't look forward to seeing the doctor, having procedures done, or any sort of whatever it takes. Free, because it's free, doesn't mean people are going to use any more of it. Okay, they will use what's necessary, and that's all. Right? So this idea that because you've made it free, you're just going to amp up the demand is, I don't think, a valid point. I don't think the analogy holds. When you compare it to entertainment, seeing movies, it's fundamentally different. The usage model is fundamentally different. People don't go to hospitals for entertainment. They don't get any pleasure out of it. They go to fix a problem. Okay, once it's fixed, they don't keep going back. All right, so I think that analogy is just really bad. And the fact that people keep using it, it just shows that you have to use an analogy to try and justify this thing. You're not using the healthcare system itself. There's no need to use an analogy to describe what will happen if there's free healthcare. Why use an analogy? Why don't you speak about the thing itself? Because the thing itself, people don't go for medical care they don't need. It's ridiculous. All right, so that's all.